Dr. Terry Alani is a frequent guest on our show, but every week she also combines her background and knowledge with her younger brother, orthopedic surgeon Dr. Wayne Alani, on their radio show.
Right, exactly. Well,
emergency kiosks. Well, that's a pretty good idea.
yeah, but
Look at them right there, having a good time. All right, please welcome them back to the show. Good morning. Good morning.
Good morning.
That's got to be fun to actually work together, and you actually work together well.
It's a blast. Well, I think it's because I'm older.
So
I can push you around.
Yeah, and she is older, so just keep that in mind. I do say that on the show. Yeah.
During the commercial break, it was funny. She goes, "Sit up. You got to sit up." He's like, "I'm an orthopedic surgeon. I'm used to doing
I'm used
this."
to it.
Yeah. All right. So you got to sit up for TV. Okay. So a number of things that you talk about on your radio show. It's not your typical show, but the cool thing about it is that people can ask anything, just like they're doing today. So we want to start out with some things that you also introduce people to: medical breakthroughs.
Right.
And one of those medical breakthroughs is something in dentistry called Auraverse. What is that?
Right, Auraverse, it's brand new. The press release was last Friday. What it is an advancement that actually reverses your dental anesthesia. So if you come in to see me and we numb you up on the bottom, not this bottom, this bottom, we numb you up and you're usually numb for about 3 to 5 hours.
Right.
Well, this advancement, it's in the form of a shot, just like the original shot we give you. We place it in probably about 3/4 way through the procedure, and it actually reverses the anesthesia time, cuts it in half.
Well,
so
cool.
you can walk out and 30 minutes later you have all your feeling back.
Yeah, and you can drink something without spilling it all over you, or without coughing like that.
Yeah.
Okay. A while back, there was this big study that said, hey, chondroitin and glucosamine are great for arthritis, great for any kind of bone problems you're having, but now we're finding what?
Well, the most recent studies show, well, first of all, chondroitin and glucosamine are supplements to try to make your joints healthier. The theory was that if you take the oral pill, it will help your cartilage get better inside the joint. Most of the recent studies show that if you have bad arthritis, it's not worth taking it because it actually doesn't cross into the joint. So more than likely what you're doing is paying for a placebo effect, which is about equal to the effect of not the medication, but the supplement when you look at the study. So if you have early arthritis, there are some studies showing it helps, but we don't know if it's placebo or if it's the actual pill.
Right.
But hey, if it works, it works.
Yeah.
So, you know, it just gets expensive because you have to take it forever.
Right.
That's the problem.
All right,
So.
let's go to the phones. We have, is it Maria on the line? Good morning, Maria. Maria?
This is Mildred.
Well, Mildred, I say that we just talk to you right now since you're the one that's on the line. Mildred, what's your question?
Yes, my question I was asking, was this the Deborah Junkin show? So I know I was talking to the right party.
Well, it's called Great Day Houston, and I happen to be hosting it. So I think you're here.
Well, that's good. I wanted, because the line's been busy so long, but I wouldn't give up.
Yes, now it's time for you to shine. What's your question?
Nice talk. I have a hurting under my left arm. I call it in my back on the what you call it? It was under that left shoulder.
Under your left shoulder,
Yes,
it hurts.
You know you call it that.
Does it feel like it's your bone, or does it feel like it's a muscle? Oh, I think we
might
lost her.
not know.
Well, I can answer it. Basic. What I would do is I would see her family practitioner would probably be the place to start, because the thing you want to rule out is that it could be your heart, because you can have referred pain from your heart to your arm or to your back, and you think it's your neck or your shoulder when in reality it's your heart. So if
that's
she has any
interesting.
shortness of breath, she has a history of high blood pressure, anything like that, I would see the family doctor. He can get the appropriate x-rays and refer her, if needed, to an orthopedic surgeon. So.
All right, let's go to Shirley. We have Shirley on the line. Good morning, Shirley.
Good morning.
Hi there. What's your question?
I've been diagnosed with osteoneurosis of my right hip, and I'm only 48 years old, and I want to know what I can do for it.
Okay, what she's saying is osteonecrosis, which is another word for what we call avascular necrosis, AVN, and what that is the blood flow to the hip ball actually dies or it diminishes. People may remember Bo Jackson a long time ago. He had that. He had to have a total hip for it. If you're in the early stages, first you have to get an x-ray and an MRI. If you're in the early stages, you can do a procedure which is called a core decompression, where you actually go in and we use a small drill, not to gross anybody out, but actually open up a channel to get blood flow into the hip.
Right.
That's without doing a total hip replacement. If it's past that and it's really involved in the joint, it's very arthritic, you probably have to have a total hip replacement.
All right, and then for you, Terry.
So I like my brother. He's so smart.
I love him. I love
Yes.
him. It runs in the family. There are other siblings. One's a lawyer and one's a teacher. Okay, your parents did something right. All right, thank you too. You can catch your health with Terry Alani and Wayne every Tuesday from 1 to 2 p.m. on CNN, that's 650 AM radio. For more information, you can also log on to TexasToothLady.com or call Dr. Terry Alani at 713-612-51.